AM 1430 KRGI, 105.5 FM. Good morning. I'm Brian Gallagher. It's 8:45. Guest in studio from Central District Health Department. Colette Evans comes in. We get caught up in all of our stuff ahead of time before we get going. But the real reason she's here is to talk about something that's really important and deserves, for just a few moments, your undivided attention. We're going to talk about the importance of Breast Cancer Awareness Month.
Good morning. Thank you for having me. October is Breast Cancer Awareness Month, and so we really want to shed light on the importance of women and men making sure that they're doing regular breast checkups and that women are going in for their yearly mammograms and following up with any diagnostic treatment after that.
Remember how we were talking about how it's important that you give your undivided attention? She mentioned it. It's women and men. Now, how many male cases of breast cancer appear? Is it a percent? But, I mean, is it a low percentage or is it growing? Cancer's scary, so, I mean, it's nothing to mess with.
It's a small percentage of men, but I think that a lot of that is because, in general, people don't think about men getting breast cancer, so they don't necessarily think to check or to talk to their physicians about it when they're going in for their yearly physicals. The focus has largely been on women and breast cancer because it's so prevalent in women, not just in the United States, but globally. So men tend to kind of get overlooked or forgotten about. And it's important to remember that this does impact men, and they need to be aware and be checking as well.
Here's another reason for you to pay extra attention, because in the little fact sheet that she brought me, it talks about the number of people that die annually due to breast cancer.
There are 685,000 people who globally passed away from breast cancer in 2020. And each year in the United States, about 240,000 women get breast cancer, with about 42,000 of those women passing away from that disease.
So it is important. It is something that you need to have an awareness of and make some decisions about. So what can people do to lower their risk?
They start by keeping a healthy weight, making sure that they're seeing their physician regularly, and going in for those yearly exams. If you choosing not to drink or having a low consumption of alcohol is helpful. Making sure that you talk to your physician if you're on hormone replacement therapy or birth control. One of the other things that really helps lower the risk of breast cancer in women is if they have children and they breastfeed their children.
So it's Breast Cancer Awareness Month, and Colette's here to tell us about some of the things that you can keep in mind and need to keep in mind about things you can do to help prevent the cases in your family. If you have a history in your family, it's good to talk with your medical provider. That way they can help to try to trace it and maybe give you the right test to come up with, hopefully, the right answer that you're clear. But if not, earlier discovery is always better.
Absolutely.
All right. Otherwise, if they have questions, what can they do? Because I think you've got, you've got an event coming up.
Yep, we will be at Project Connect.
Okay.
And that is next Thursday at Funner Park. So we will have information on that. We participate in the Every Woman Matters program. So that's a program for women who have no insurance and maybe are low income and think that they can't afford to go in and get those breast exams. We can help them enroll in that program so that they can get the medical attention that they need. And we'll be in a position to talk about that at Project Connect. Otherwise, they can call our office at 308-385-5175.
Colette Evans from Central District Health Department. It's always a pleasure.
Thank you.
Good morning from AM 1430 KRGI 105.5 FM.